Okay, today we are going to demonstrate how a smart side is done for Fitzpatrick grade 3 sort of skin, which is she's from Southeast Asia, and there is some grade 2 or even grade 3 scarring from acne. We have already numbed the area with some Emla with some 20% lidocaine, and we have cleaned the local out and have cooled the face down. So we are literally starting with the smart side at the lowest possible dose. I've just given one shot to see how the skin is reacting. If she's happy with it and there has been no pain, I would ask her, have you had any pain?
No.
No? Okay. Now we're going to do the whole face bit by bit. The important element is this treatment does or has the possibility of causing hypo and hyperpigmentation, particularly in Asian skin. So we need to cool it down, and I'm using a contact cooling to reduce the chances of the pigmentary changes. Even before the treatment, she was using hydroquinone 2% with a tretinoin 0.03%, and she has stopped that for the last couple of days, and now she's having the treatment, and again she'll restart it for another 2 or 3 weeks before her second treatment. How are you feeling?
Still okay.
No pain?
Tingles.
Tingles. This intermittent contact cooling is vital so that the skin remains completely calm and the treatment doesn't cause or reduces the chances of the hypopigmentation or even hyperpigmentation. She will probably need anything between 4 to 6 sessions, because by virtue of the fact this is called fractional, means we are only treating part of the skin. It's a fractional resurfacing, and it's a CO2 laser, so it's a ablative laser. That means tiny bit of the skin is being ablated, which is burnt. I'm using the lowest power today because her skin needs to get used to it, and as the treatment progresses, that means as she has the second, third or the fourth treatment, we'll try to increase the power according to what her skin is demonstrating. If there's any side effects, we'll then stick to the lower power. If there is no side effects, which I'll be very surprised if she has any, then we'll slowly increase the fluence or the power of the treatment. She's being a very good patient, of course. She hasn't even flinched up till now, but she had the cream for over 20 minutes, in fact probably half an hour. That does numb the skin very nicely. Okay, would you kindly hold this side? Then we'll go to the other side, which is nicely cooled down. And we've got a fresh one for you for this side. And we're going to start on this side. Alright? Ready?
Okay, yeah.
Just turn your head a bit this way. Perfect. Again, the intermittent cooling is important because all the major complications of fractional CO2 are not eliminated but at least reduced significantly by the skin cooling. You alright?